Let's talk to Professor Robert West, who's a public health expert at UCL, University College London. Thanks very much indeed for joining us on the programme today. So we've been hearing from our correspondent there about mixed feelings from people about the removal of most COVID restrictions in England. You yourself have recently called it madness. So why do you think that? Why do you think it's reckless?
Because for the very obvious reason that we have infections rising exponentially. We have hospitalizations rising exponentially, albeit at a lower rate. And we have deaths rising. And in these circumstances, it's worth bearing in mind that on the last couple of occasions where we've had these waves, the only thing in this country that's brought the infection rates down was locking down, and that's the last thing we want to do. So if we open up now, which we have done, we will see, everyone agrees, we will see that all of these figures are going to go up even faster, and we don't know where they will end. The government's epidemiologists have said there's huge uncertainty about where this will end before we get to a point where the disease naturally plays itself out. This is an immense gamble with people's lives and with the economy and with people's livelihoods, because unless you're going to say to people, well, you don't have to isolate anymore if you get infected, which would be crazy, you're going to have vast numbers of people having to self-isolate with all the damage that does. So for all kinds of reasons, it is literally madness.
So what kind of restrictions do you think should be maintained now?
Very obviously, wearing face coverings in enclosed areas, public areas. And I mean, that's not a panacea, but the evidence, which wasn't there a year ago, now is there, pretty strong, that makes something of a difference. Personally, I mean, I'm really sorry for the owners of these businesses, of nightclubs and so on, but having large numbers of people in close proximity to each other is an absolute breeding ground for the virus. So I'm afraid opening up these venues is pretty foolish. I think that one of the things that again the government hasn't done, but it has been advised to do, is to start the process of getting people ready for a long-term risk management approach in terms of getting venues properly ventilated, getting people fully aware of what risky situations look like and how to handle them. And I still hope that eventually the government will do something about that. But at the moment, it's hard to avoid the conclusion that the government is trying to get everyone infected as fast as possible.
Well, the government's message, the Prime Minister's message, is if not now, then when? But so with that in mind, doesn't there have to be a time when things do open up? And if not now, why not now?
Well, I mean, if not now, then when is such a stupid thing to say, because it's very obvious when. It's when we have things in place to mitigate the risks for people and to keep the infection rates under control, not least having more people being vaccinated. And at the same time, I know I'm sounding very critical of the government, and to be fair, I have been quite critical of it for most of the pandemic, as have many other public health people. But, this is at a time when the vaccination rates are going down. I mean, we've not been able to sustain the level of vaccinations, and we're not quite sure why that is, but at least part of it seems to be a problem with supply. So we're not winning on the vaccination war, and we're opening up at a time before we have enough people vaccinated to mitigate the risk, at a time when we're not even doing the things that we've been advised to do, or the government's been advised to do, in terms of creating a proper risk management scenario for the country.
Professor Robert West from UCL, great to get your thoughts today. Thank you.